Hello, my name is Aaron Kane Bayot, and I'm going to be talking about addressing health disparities in partnership with Health and their Unity project. So the research question is mainly focused on the aim of the Unity project. Basically, the question is, what are the barriers and factors that prevent or inhibit individuals from obtaining existing resources? How can the Unity project close the gap between community members in filling social determinants of health? So a quick overview, telehealth aims to provide preventative healthcare, specifically reducing gaps experienced by underserved and marginalized communities. So in addressing health disparities, telehealth kind of wants to see what are the kind of barriers that their clients may face and how they can better provide for them in terms of the care that they're providing. So with that, we're going to talk about the research significance. So health disparities are a major public health concern because they disproportionately affect BIPOC communities. Since telehealth primarily serves these communities, marginalized and underserved, it is important to understand the barriers that they face so that despite them being disproportionately affected by health disparities, this can kind of help telehealth reduce the gap that they may face and provide the best quality of care possible for them. So with research significance comes the methods. The primary method in this research capstone is a secondary data analysis. So this is just the use of various literature from various databases, such as from the National Library of Medicine, PubMed, specifically Elsevier, and other research journals. Telehealth actually provided me with foundational documents and articles, such as the project executive summary, the City of Los Angeles City and Community Profiles, as well as the South LA Health Equity Scoreboard and CHLA Community Health Needs Assessment. So being able to look over these articles allowed me to kind of kickstart my research and understand the kind of demographics that are present that telehealth clients serve, what are the different trends that we see in these communities, and this allowed me to kind of identify what barriers I can identify, and doing so, we would be the next part of the method section would be the interview. So the important part with the interviews would be to understand how the previous literature that exists, if there's any correlation between the barriers that are found in literature, and if these are specific or pertainable or pertain to telehealth clients. So essentially, the interview will help to kind of determine the accuracy of the literature found and identify if telehealth can use this as a way to improve the quality of care that they're providing. So in doing so, literature review, I would like to highlight four research articles, specifically the work of Hamed et al., which talks about racism in healthcare and how it can discourage minority groups from accessing care. This goes hand in hand with barriers in healthcare for Latinx patients with limited English proficiency, which is an article created by Escobita et al., who surveyed Latinx, identifying individuals who reported lower healthcare satisfaction and mistrust in receiving healthcare. So with racism and limited English proficiency, these individuals are usually within like lower socioeconomic groups and are usually among the underserved and marginalized communities. And oftentimes, clients, although they may understand that there are resources available, that there are healthcare organizations that they can seek, oftentimes they feel that they are discriminated against or that the quality of care that they're receiving is less than quality of care that they would be received from other ethnic groups. So with that, it is important to understand that we or healthcare organizations must be able to provide cultural competent care. And in order to do that, solutions may range from firstly being able to be trained in diversity and inclusion, as well as being able to have staff that are from these communities. So being able to provide a relatable or being able to provide empathy with these populations is very important. Another barrier that I found in literature would be the transportation barriers to care. As Cochrane et al. 2021 gathered data, although this was from the COVID-19 pandemic, it only shows the emphasis that needs to be placed on handling transportation barriers, where 1 out of 3 respondents reported transportation barriers. Um, it is important to understand that it is better to have received healthcare rather than not receiving healthcare at all. And with transportation barriers, that can be an extreme problem. Specifically with the article, it talks about how transportation clients oftentimes either did not receive healthcare at all or were late to their appointments. So being able to identify solutions with that will be very important and will be discussed shortly. And lastly, with barriers to accessing healthcare, Schwartz et al. Talks about health literacy as another barrier that individuals may face. So although there are these healthcare resources that exist, it is important for Schwartz et al. Emphasizes how health literacy must be increased and improved. And in order to do that, clients must be able to build compliance and have accountability with the care and treatment regimen that they're provided. So with that, there are research implications. The first thing I would like to highlight is telehealth, which is to reduce transportation barriers specifically. So telehealth essentially means to provide healthcare within a digital device. So whether that be primary care or medical consultation, telehealth helps to kind of reduce that gap with transportation barriers. Another Salmon 2021 talks about Los Angeles food policy and alternatives to incarceration that kind of talks about combating systemic racism as well as food instability. In another article I found by Sanito et al., it talks about how certain individuals from lower socioeconomic groups, so individuals that fall under the underserved and marginalized communities, oftentimes will prioritize housing and food instability over healthcare access and medication. So being able to have support with food instability can help individuals not have to compensate for their healthcare quality and access, because eventually individuals will more likely require care. And if, for instance, if a client or individual were to face cardiovascular disease or cancer, various health diseases, they would most likely receive care when the disease is at a more advanced stage. So being able to address their health concerns as quickly as they can in the time that they need is very vital. And lastly, there needs to be more representation in terms of the research that is done. Specifically, Yeoman Lord talks about Asian American subpopulations and importance of not generalizing all Asian American groups to the main Asian groups, but having subgroups be able to have their own data to provide more inclusive care. So although it talks about Asian American populations, this can be kind of focused with other ethnic groups as well. So being able to understand that although there are major groups within ethnic groups, it is important to understand the subgroups that are relevant within them as well. So telehealth, as they address health disparities, there are different solutions and recommendations that I have found, as well as the barriers that they face. And next steps would be, of course, the methods of performing these interviews. But this is the research that has been conducted so far. There are other literature that I've found that were not discussed in this presentation, but racism, just to go back, transportation barriers, health literacy, and language barriers present as some of the main barriers that underserved and marginalized communities face. So and acknowledging those and finding recommendations for those have been the emphasis of the research so far. But besides that, thank you so much for listening. And I hope you have a great day. Thank you.